At naka-reserve na yan kay Sec Bills, yung second dose na yan. Imagine, almost 80%, 79 point something. No? At December 15, siguro kaya na natin 88.99, halos 90% na tayo by December 15.
Restaurants are now allowed to operate but at a limited capacity and with preference to fully vaccinated people. Will this move by the food business help in encouraging more people to get vaccinated? We discuss in this episode of The Chiefs. And welcome to this weekend edition of The Chiefs. I'm Ed Lingao, and also with us, Ana Marie Pamintuan of the Philippine Star and Lucy Cruz Valdez, the head of News 5. Ladies, happy weekend!
Hi! Happy weekend!
Yeah, tatlong
Happy
araw
ba
na lang,
talaga?
Lunes na.
Ewan ko, kakain na yata si Ed sa restaurant eh. Kumain ka na ba, Ed?
Hindi ako kumakain. I don't dine in.
Dine in?
Yeah, puro lang ako order or take out. Better to be
Tsaka
safe than
dito,
sorry.
tsaka dito yung al fresco, hindi fresco eh. No?
Hindi fresco.
Lalo na pag lunch. Either umuulan or ang init.
Oo, kaya malapit na sa Tambucho.
Well, 54 areas daw sa Metro Manila naka-granular lockdown, ha?
Yeah, 50
Grabe,
plus.
no?
50 plus, yeah. That's
Tsaka ano pala, no? Hindi ka pwedeng magpabakuna kahit na may vaccine schedule ka. Kung naka-granular lockdown yung lugar mo. Ang tindi nun, ha? Ganon kahigpit.
kasi ganun din yun. Lalabas ka din. With or without an infection, to get vaccinated, lalabas ka rin and you're breaking the lockdown. And that defeats the purpose of the lockdown.
Mapapaaway ka sa kapitbahay mo niyan, eh. No? Hindi, di ba? Kasi parang magiging parang
Parang ikaw ang dahilan.
sisihan, di ba?
Yeah.
Sisihan, eh.
Yeah. But we had some pretty good numbers last night from Chairman Abalos that we'd like to ask our guest later on tonight. Really good numbers, at least it sounds like. Almost 80%
Yung vaccine. Yes.
naka-first dose na sa Metro Manila. And hopefully by middle of October, maka-second dose sila. So that means almost 80% second dose by October 15.
At may dumating na
Yun lang,
bagong
may
private sector, no? Yung
Pfizer.
Yeah, may mga bago pang parating. And so the
Yeah.
numbers really are looking good, at least for Metro Manila. At least for
That's
Metro Manila.
Metro Manila, ha?
Yeah.
Sa Davao City, yung turf ni President Duterte, yung anak niya, si Mayor Sara, nag-issue ng executive order requiring all government workers to get vaccinated. Sabi ng DOH, bawal daw yun.
Oh,
Bawal
it's making it
mag-mandate,
mandatory,
eh.
no?
Bawal mag-mandate.
Mandated vaccine.
Yeah.
Natin,
Hindi, tsaka Ed, I mean, ang dami na talagang mga pag-aaral that show that Sinovac wanes after 6 months, no? So, ang dami na, and in fact, marami na mga health workers na nagsisevere. Lumabas na yun, di ba? So, talagang baka dapat itanong na rin natin kung ano bang booster
So there's also
plan.
the question of booster shots. But I do remember earlier this year, may reports na coming from Abu Dhabi na they were requiring 3 doses of Sinovac. Because
malakas nga daw siya kung 3 doses.
and they weren't talking about booster
really?
shots. They were talking about 3 consecutive doses of
Malakas
Sinovac
daw yung
needed.
3 doses.
So, ilang weeks after the second dose?
I'm not really
Ganun
sure.
din?
But I saw the stories coming out of
3 weeks din.
Abu Dhabi and UAE. I think it was
longer
around
yata.
March thereabouts.
Yes, ang
Yeah.
Cambodia started inoculating their 6 to 11-year-olds, Sinovac
Yeah.
and Sinopharm. Para daw nakapag-umpisa na sila ng school.
Yeah. But whatever the case is, whether it wanes after 6 months or less or more, the fact is that you get at least 6 months
Yes.
of protection. So
yun.
I suppose that's still on the table, getting
Ah,
protection
hindi lang
anyway.
naman Sinovac, We have to emphasize all the vaccine brands, merong mga breakthrough infections, kahit Pfizer,
Yes, meron. Pero yung sa Sinovac, nagiging severe. I mean, after 6 months. In other words, yung full protection that we want in terms of the severity of the COVID, nawawala. Kasi kahit papano, di ba, malaking konsuelo na pag bakunado ka, hindi ka ma-ospital or hindi ka gagrabe, di ba?
Yeah.
So medyo sana nga,
Sabi naman nila,
sana,
naggaganyan daw kapag yung high exposure, di ba? Yung mga health
yes.
daw, kaya nga pinupush nila eh. Pinupush nila yung ano, di ba, boosters for
Yeah.
health workers.
And remember, earlier this year, or was it late last year, we were having this conversation as well. Now, this is going to be a conversation we will have every year, at the very least. At the very least.
Oh, definitely.
Siguro yung health workers,
Definitely. Baka nga more than once a year yan.
Yeah,
Diba?
well, at
Yung
this
mga
point kasi we don't
booster.
really know yet. Wala pa.
Kaya lang yung supply natin continues to be pathetic. I mean,
parang flu shot. Nandiyan na si Dr. Ano, yung...
Oh, is Dr. Solante in? Can we already bring in our first guest for tonight, Dr. Ronjin Solante of the Vaccine Expert Panel. Dr. Solante, oh, there you are. Sir, thank you for joining us and welcome back to the Chiefs.
Hi, good evening,
evening, Doc.
everyone. Good evening.
Hi, Doc. Happy weekend po, unang-una. We wanted to start off the weekend with sana a happy note. Recalling last night's interview with Chairman Abalos of the MMDA, na ang sabi niya, well, we're almost hitting 80% first dose for NCR adults, which is the target population to begin with. And sabi niya, hopefully by mid-October, we will have that second dose already all in. So mga 80% Metro Manilans na adults, 80% na fully dosed. So what would that mean as far as mobility, as far as health concerns, as far as protection against COVID? What would that mean for NCR?
Well, for us healthcare workers, no, that will be a big boost to our healthcare facility because less people will be admitted and less people also will develop the severe infection. But I just have a part to say on that aspect of NCR having 70 or 80% in the next few months, no, or 2 or 3 months, no. This is the experience on the ground, no. Like San Lazaro Hospital, more than 50% of our admissions are not coming from NCR, and in fact, they're coming from nearby, like Cavite, Bulacan, Tarlac. As far as Tarlac, and in fact, even we have Bulacan, Batangas, no. So that means that
yes.
we are experiencing low number of cases in Metro Manila, but we are not necessarily neglecting the other areas nearby, no, because a lot of these workers are also working in NCR. I don't see any. Hopefully, no, it can impact on the NCR, but how about those nearby areas?
Yes, so it's a good point.
That's a good
That's
point.
a good point.
No? Yes. What do we know about the vaccination rates in these suburbs or neighboring cities
provinces
and municipalities? Yes.
Ganito yan, Lucy, no? Every time I go on rounds, no? I made rounds every day, no? Both the private and the government hospitals, and I see a lot of these patients, not necessarily from NCR, coming from these different areas. At palagi kong tinatanong yan, nagpalista na ba kayo? Yes, nagpalista na, Doc, pero wala naman tumatawag, ang bagal. So, I mean, naabutan na lang sila ng infection to the point na talagang nagka-hospital sila. So, sabi ko, I think there is really a disparity now in the distribution of these vaccines, more focused or concentrated in the national capital region, but not on these nearby provinces, which are also as vulnerable as the NCR because of the density of the population.
Mm-hmm.
Well, in the meantime, your vaccine expert panel daw, Doc, is looking at the efficacy data, no, on using other brands as boosters for Sinovac. Pinag-uusapan na talaga yung boosters ngayon kahit even if we don't have enough vaccines, Doc. And can you tell us more about this, yung crossing brands for a third shot of Sinovac in particular?
Okay, I would like first, no, to make mention about why we mention about booster, no, and it is because of the data coming from some of these vaccines that immunity wane, so meaning the protection wane after 6 to 8 months, and the most vulnerable among these, of course, are the healthcare workers. Okay,
Yes.
and we have experienced also healthcare workers getting sick, no. Although majority are mild, There are also who are moderate and severe. But again, the point there is that if a healthcare worker will be sick, and then your people, your personnel in the healthcare facility will also dwindle, then that will also affect the function of that healthcare facility. Okay, so that's the reason why that when we make that rationale and point of a booster, we have to select which vaccines has the data that immunity has waned, and so that's the recommendation. But I think it has been with the Department of Health now that it's up to them to decide on that based on some of the areas that we need to consider, like the limited supply of the vaccine in the country. Second is that is a third dose still enough to protect us against the Delta variant, or do we need another platform for those who have been vaccinated? So these are the things that we need to weigh in, no, at this point in time.
Pero
What
Doc,
do you mean by another platform, Doc? I just want to clarify. So you're saying it's what is that? Because you just said no, o booster ba or another platform? What would be another platform?
I'll give you an example. No? So halimbawa, you have received 2 full dose of your Sinovac in March, no?
Yes.
So the third dose, will this be a third dose of a same platform like Sinovac? Or will the third dose be an mRNA vaccine or a virus vector vaccine like Astra? You know, so something like that, no? So which we have to evaluate which among these 3 platforms will give you a better protection, because when you boost, so binigyan mo na ng pangatlong then you have to maximize na lang ano ang pinakamagandang protection against the Delta variant. No?
Right.
pero Doctor, did I get it right na may recommendation na kayo to the DOH? Anything specific for health workers ba?
Yeah, but the current data tells us that a third dose of Sinovac gives you a higher protection, no? Better protection compared to the 2 dose after the waning on the 6th month. No? So that's the recommendation.
So after six months pa, tapos the same. I see. So hindi ka pwedeng mag-ibang platform, to use your word, or pwede rin.
There are already data now coming out, no, that another platform can be as effective or higher than that compared to a third dose of Sinovac. And there are countries now using another platform to those fully vaccinated with Sinovac. I'll give an example now, because I've talked also with my colleagues there in Thailand. No, they're giving AstraZeneca as the third dose, or those who received the first dose of Sinovac, they gave AstraZeneca. Okay, so that's their vaccination strategy option for the healthcare worker. In Indonesia, they're giving an mRNA vaccine. After the 2 doses of the Sinovac, they're giving a third dose of an mRNA vaccine. Okay, so these are all healthcare workers. These are not general public. So these are just specifically for healthcare workers.
Yung healthcare workers nyo, Doc, specifically for COVID referral centers, yung recommendation nyo, or for COVID wards? Or
for COVID referral centers only. So selected COVID. So these are the healthcare workers who are taking care of COVID patients on a daily basis.
So how many are we talking about?
I don't have the figures now, but mukhang konti lang to, kasi we're talking about mga referral centers in Metro Manila, primarily government referral hospitals, no? And that was the recommendation.
So, kung ganyan ka konti, it's possible na papayag ang DOH. You think?
I cannot answer that, no? So it's up to DOH to decide on that, because it's still DOH who will really give the final decision on matters related with booster and those who will get the booster.
Doc, I do remember
Okay,
as
but
early
if
as
you're
last
not
year.
a health worker, sorry, but if you're not a health worker and Well, do you think there is a need now, especially for those who had taken their first and second doses early on, like let's just say May? Should they be preparing themselves for booster shots, say November, ganyan?
Because of the limited number of or supply of the vaccine, the target is still vaccinating those who are not yet who has not yet received any single dose of the vaccine.
So hindi yun makakasira ng diskarte natin na kasi nga, di ba, we're trying to vaccinate everyone, as many as we can. That's I mean, but so many also are moving into the 6 month, wane period. Uh, is that something that we should be concerned about, that we're hitting a point where the vaccine might have waned and people will need a booster shot already?
Yeah, that's part of the consideration, no? But we are only prioritizing people or those at high risk of getting the infection, especially the healthcare workers, because of the
Supply.
amount of the exposure that they go through every day, no? And it's really the supply that's really the factor here.
I guess the point is we should be procuring those supplies now, right?
I
mean,
hope
in
so.
preparation. Yeah.
Yes.
Doc.
Okay.
Actually, Doc,
Sorry,
that's also
Ed.
what I meant to ask eh. Kasi I do remember that we were having this conversation nga as early as last year na eventually we might have to be talking about procuring vaccines every year and so on down the line. I know in the immediate term we have to think in terms of boosters for the health workers and for those who have not gotten their primary vaccines yet. However, come next year, come middle next year, you would have another batch of people who will have to get their possibly booster shots. I'm wondering lang if it's all been factored in already in the planning, in the budgeting, and all that. Kasi like you said nga po limited ang supply ngayon pa lang, I suppose hindi matatapos yung problema sa limited supply
Yeah.
So yun po question ko po is naitabi na ho ba yung budget at yung pera at naplanuhan na po ho ba yan na baka next year kailangan natin ng this many million shots again?
Exactly.
And again.
Yeah.
Well, I think DOH is working on that, no? Not only procurement for the primary vaccination for those who are not yet vaccinated, but also should also be factoring also the possibility of a booster shots for the vulnerable population. It's not for the general public, but it's really for the general population that we need to prioritize.
Gaano po kalaki yung chances na mag-mutate daw kapag nag-wane kapag yung breakthrough infections, tama ba yon that they open the gates to more mutations? Is that an
Yeah, the current what we're seeing now is that if you are fully vaccinated, you may still develop the infection, no? But your chance of getting the severe infection is not that high compared to an unvaccinated. That's the reason why we still need to focus on the unvaccinated. Now, as long as there is community transmission and there are those people that are not vaccinated, then the risk of a mutation is always there. That's why the objective is really to vaccinate everyone as possible as in a short period of time so that we can not also increase the risk of further mutation.
Doc,
Is it true that senior citizens and people with comorbidities now are still at risk of severe COVID, even if
Yes.
they're already fully vaccinated?
Yeah, yes, Lucy, and that's always even before when we talk about flu vaccines, when we talk about pneumococcal vaccines, we focus on the elderly population that they should be receiving the vaccines. In fact, if you look at influenza vaccines through time, the efficacy does not, or the effectiveness does not exceed like 65%. No? Sometimes it's less than that, in a year. But why are we giving this? Because a 45% effectiveness or efficacy is already very important for this elderly. Although the risk is still high for them to develop severe infection, but giving them the vaccine hopefully will also lower that risk. Same also as pneumococcal vaccination. No? We focus on the 50 years old and above. The elder, the higher the age group you have, like 75, 80, chances are your efficacy will really be very, very low, and you still develop the more severe form of infection. That's precisely what's happening also with COVID vaccine. If you are elderly, 75, 80 years old, you have comorbidities, your response, your protection against severe is still at higher risk. But again, we are giving them because chances are if you're not giving it, then you have the higher risk of getting the more severe infection.
Okay. Maraming salamat, Dr. Ronjin Solante of the Vaccine Experts Panel. We were hoping to have good news for the weekend, but no, well, at least we have realistic news.
Yeah, so I think, Ed, no, I think the more important news here, if Metro Manila will be vaccinating a lot of persons, that's one good news because that will affect our healthcare facility and less people to develop the severe infection. Itabi muna natin yung booster shots, no? Kasi marami pa tayong pag-uusapan regarding kung kailangan pa nating bakunahan yung mga walang bakuna.
Okay, bumawi si Dr. Solante. Doc, happy weekend to you. Salamat po.
Bye-bye.
Salamat sa pabaon. Thank
Dr.
you, Doc.
Okay, Dr. Ronjin Solante of the Vaccine Experts Panel. Maraming salamat, Doc. We'll go into break, so please stay with us. Welcome back to the Chiefs here on One News, and now joining us is Mr. Eric Teng, the president of the Restaurants or Restaurant Owners Group, Resto PH. Good evening, Mr. Teng, and thank you for joining us.
Good
Good
evening,
evening, Mr. Teng.
Good evening
Well-
po. Thank you for having me.
Yes, sir. Sir, just the other night, we were talking to Sergio Ortiz Luis ng ECOP, and he was warning us na maraming mga restaurant owners daw malamang ay kahit may 10%, 30% na papayagan indoors and outdoors, marami pa rin daw hindi magbubukas dahil I suppose parang economies of scale eh. Not enough people, baka not worth opening. I don't know, ano po yung numbers niyo from what you could see? Ilan po yung nagbukas versus what you expected?
It's very difficult to look for data right now. It's only been 2 days, but also because restaurant is a very diverse industry. We also cover carinderia as part of our industry. So you're right. There are certain restaurateurs who would rather not open at 10% capacity because it's sometimes also painful to open at 10%.
Yeah.
But for a large part of our membership, 10% is already better than zero. And for myself personally, I would rather open with 10% and hire a few people, give them some paycheck so they can start, having a life again. Otherwise, they're just waiting for help, or they're doing sidelines. They're being they're part-timing as GP drivers or delivery drivers, and sometimes that's a very risky situation for them. So getting them back into the restaurant where they're protected in some ways, it's much better.
Yeah.
But are you doing simultaneous, delivery system and at the same time actual face-to-face service? Is that what it's come to? Parang sinasabay nyo na lang yung negosyo to maximize.
Delivery, for example, in our business is probably around 10%, 12% of total sales. which is quite small. And sometimes it's really not worth doing because the amount you pay for delivery services is quite high, 20+%
Yeah,
Yes.
yeah.
of sales. So, but sometimes that's a necessity when you don't have dine-in. But now that we have dine-in customers, it doesn't hurt to have delivery. It doesn't hurt to have takeaway. We try to get as much sales as we can because every test
Yes.
counts right now. Every minute, every day that we can stay in business, that's really vital. We're hoping lang that we can carry over from a bad third quarter to a healthier fourth quarter, hopefully.
Right.
It's just a matter of days.
So among your members, Mr. Teng, kumusta naman tong the first 2 days of the shift to, well, easing of restrictions on your sector, no? Kumusta naman po yung foot traffic for dine-in?
It's better than I expected, to be honest. I wasn't expecting much because I felt people are still wary of going out, but we were surprised yesterday. It wasn't, tremendous fiesta kind of atmosphere, but it was healthier than expected. And today was also a good day, but it's never a dangerous situation. It's never a crowded situation where people are lining up or crowding up just to get into a restaurant. No, that's not the case at all. But I'm seeing a healthier perspective of our consumers. Once they're vaccinated, they're willing to go about, but then they still practice, the safety protocols, mask distancing, and hand washing. So, and also in the restaurant business, we're used to that even before COVID.
Are there a
But do
lot?
you find yourself
Yeah.
But do you find yourself having to turn away customers because you
Yeah.
you
And,
you stand a chance of exceeding your 10% indoors and 30%
and how
outdoors?
difficult
I mean,
is
I
that,
just
di
wonder.
ba?
Yeah.
We do actually yesterday, surprisingly, a lot of people wanted to go in without bringing their vaccination card. So regretfully, we have to turn them away. But for many restaurants, we just asked them to order takeout. So that's one good business opportunity. In another restaurant, our practice would be we if it's full already, because frankly there are sometimes just 3 or 4 tables and it's already considered a full house because that's 10%. Then we get their phone number and they go about first and ask them to come back at a certain time and the table will be free for them. We try to accommodate our customers as well as we can, and we try to make the best of the current situation. There are also instances where customers, of course, restaurants, you have a blended group. Some will be vaccinated, some won't be vaccinated. So when you have a group where a party has some unvaccinated people and we don't have outdoor dining, that's when we also regretfully would have to turn them away. It's a good thing when restaurants have options of both indoor and outdoor dining, then they can accommodate both. But for malls restaurants, usually it's interior located restaurants.
Yeah. Ami.
Hindi ko ba mainit yung alfresco? I mean, I'm trying to imagine having lunch alfresco. If it's not raining, it's probably very hot. I mean, it's not like we have LA weather here, right?
It's funny that we apply the word alfresco for a city like Manila. I usually call it al pollution, not alfresco.
Exactly. Exactly. It's far from fresco, right?
Far from
Yeah,
fresco.
so I just wonder nga, sinong mga, I guess yung mga karinderya, sanay na sa ganon, no? So do you think that they're doing more brisky business now with their usual alfresco anyway, no? Do you think?
The word brisky and business and restaurant, they're not in the same sentence these days. It doesn't follow.
Malakas naman yung mga karinderya, nakikita ko. But what do you think
Oh.
of the proposal to impose bakuna bubbles?
We actually signed up for the Bakuna bubble because our feeling, our intention is that those who are vaccinated should be given more freedom. Why are we locking down the vaccinated in a situation where, like for Metro Manila, we're already at 60% vaccinated population, vaccinated eligible population, and that's the active part of our community. But to answer your previous question about Carinderia, a lot of Carinderia, if you notice, are in areas where there are schools and or university belts.
Yes.
So of
wala.
course, without school for over a year, walang
Yeah.
fitness. And now you have
Oh,
the
gosh.
dining. So, and usually those carinderias are mom and pops, and the moms and pops are lolo and lola. They're not young people. So it's a very difficult situation for them. And even with 10%, we were able to get some feedback. Even with 10%, they're grateful. Like me, with 10%, I'm
Wow.
grateful because it's better than zero.
Hmm.
Really?
But
Wow.
doesn't it
Uh,
couldn't it also cost you more in the long run? I don't know the numbers. That's why I'm asking. Couldn't it cost you more in the long run? You know, to have to employ people, tapos konti lang yung revenue coming in. Of course, of course, you do want to employ people, pero at the same time, you also have to look at survivability. I'm wondering lang how the numbers look like.
It depends. Like I said, the restaurant is a diverse industry. So with fine dining, for example, where skills are, uh, they need a lot of training time to get to a certain level, or sushi chef. You certainly want to keep your staff as long as you can, because to train them, you need to send them to other
oo
countries.
nga.
You're accepting
Yeah.
anyone for training
Yes.
in other countries. So of course,
Right.
you have to weigh your own options if it's worth keeping. And for some, if they can't do it anymore, sadly, they have to close down their restaurants and wait for better times, maybe in a year or two, or never, because the restaurant industry is not something that can be jump started overnight. You have to be a functioning restaurant to be able to take advantage of a turn in this pandemic.
Yung mga
Right.
changes implemented during the pandemic in your sector, are you seeing anything in particular that will outlast the pandemic? Halimbawa, yung take-out, ganyan pa rin ba kataas? Ano yung nakikita niyong changes that will last a long time?
Well, for example, excuse me. For example, last year was an interesting study. For lack of a better word, it was a study. When we started dining again around July to November, before we opened in July, there was a strong delivery business, takeout business, because that was the only business allowed. But once dining started again around July and it started to pick up, we saw a lot of the home-based kitchens start to reduce, in terms of sales or capacity. And some they went back to their day jobs, so they can't keep doing what they're doing because it was just a stopgap work for them.
Measure.
So
Yes.
now for this year, people are sort of used to it. The restaurants are used to being locked down now. So we're used to skeletal staff. We're used to smaller menus. So those who were not working before this lockdown, they already have their other sidelines. They already have their other side jobs. So during the lockdown, again, you saw a spike in home delivery, but the spike in delivery was actually from the restaurants themselves who were actually operational at the time. So in other countries where dining has already improved a lot, they also saw a decrease in delivery of food because let's face it, restaurant experience cannot be substituted with home delivery unless you're
True.
delivering pizza or burger. But if you're talking about fine dining, even simple the basic steaks, you really need to be in the restaurant to enjoy that.
I'm curious about the smaller menu. Which particular dishes are like absolutely out of the way now with this pandemic? I'm just curious. Meron bang mga ganon? Or I don't know, the types of culinary demands for certain recipes. Anong mga nawala? What can we not expect?
Um, in restaurants, they have items that are sellable. Then there are items that I wish are sellable. There are items that are my favorites but were not sellable. So at a certain point, you remember that it's a discipline, and my mom's favorite recipe, if it wasn't selling, will no longer be in the menu. So really have to go get down to basics and just focus on what people will actually order. And sometimes what they order, it can be very basic or it can be very fancy. So it's a very interesting new jungle for us, and we're trying to figure out where north is. We're trying to figure out what animals we're trying
Yes.
what kind of animal we want to be
Yeah.
For this new world. So it's a very experimental stage at the same time, but you also go back to a tried and tested formula and remember your fundamentals.
Yes, sir.
The success will vary, for all those three examples.
Pero sir, can you give us some
what-
examples? Well, your learnings over the past year and a half as to what kind of food yung talaga, yung solve pa rin, tapos yung parang malabo na ngayon.
I would
Patikim na,
imagine
patikim.
before,
Anong mga pagkain?
initially when
Lechon. Lechon eh.
Lechon was a favorite. Lechon is one of the top winners.
Oh, really?
Talaga?
Okay, that's great.
Lechon, it's
So,
still indispensable. Lechons and cakes, anything that
Alright.
you can do massive parties. Because let's
Ah.
face it, parties did not disappear when they locked on the restaurants. That's one of the dangerous things that happened.
Okay.
Oh. Yeah. So anong mga nawala? Steak, ganyan. And I'm just curious. I mean,
Yung
what?
malalamig, saka yung mga raw. I think people are more worried about eating.
Yung mga sushi, ganun. Sashimi.
My restaurant is Genki Sushi. We focus on sushi and sashimi.
Oh, so yeah, that's great.
Yeah,
Oh, so pwede pa rin.
surprisingly, we were doing, we're doing well with our delivery and takeaway. But of course,
ano-
we shy away from the very sensitive stuff that are like good for just a few minutes. We don't want to do that.
Right.
Ah,
Baka ma-food
lalo
poisoning
na
pa
pag may
yung
delivery
nag-order,
tsaka
no?
take out eh.
Saka yung mga
Yeah. Yes.
problema.
Mr. Teng, what about the pricing? I mean, I'm just wondering, did you have to adjust your prices upwards?
Price of commodities went up, unfortunately. So
Yes,
we
they
had
have.
to raise prices for certain things. But initially, there are a lot of people who thought we should lower our prices to be more affordable. But then
Yes.
again, the more affordable price point were actually what can be served by the typical home kitchen or that you can prepare at home yourself. So if you look for takeaway, that's low cost, low price, might be difficult to compete with your own cooking. So
Right.
we also discovered that the finer things and the more expensive stuff can also sell. However, the presentation can now suffer because it's not as nice as we'd like to see it.
Right.
And for example, sushi or sashimi, you can't just make it at home. People think it's just raw fish. It's not. There are a lot of things that go into it. So it does take a lot of skill set to be able to give you that quality, and that's still irreplaceable. The experienced staff is still irreplaceable for that.
You think the home kitchen businesses will continue to thrive after the pandemic?
Gusto malaman ni Ami yan. May bake shop yan eh.
I suppose the top 20% that sells 80% of the home delivery business would survive and grow. But if an outfit is neither here nor there and they're not doing anything special or spectacular, nobody remembers their food. Of course, those home kitchens might suffer. I've discovered a lot of new favorites now, ordering from friends, and I must say that I wish they would stick around after the pandemic because I would still order from them.
Okay. What are
What do
you
you would be? Yeah, go ahead.
what are you seeing for the fourth quarter? Patapos na yung
Yeah.
September and everybody
Yeah.
think there will be a revival for the Christmas.
Exactly.
Are you optimistic about the prospect?
I am very optimistic. I look at our vaccinated population numbers for Metro Manila. 60% of the eligible population is quite high in a very short period of time. And we're about to hit 70% and 80% sometime in November. Also, at that time, hopefully the ICU beds will not be as full as today because you have less population that will be exposed to risk of infection. Of course, we won't go to 100%, but that was never the goal, I'm sure. So for December, you can't take away Christmas. You can't take away the Christmas spirit. That's still, we Filipinos are made for the Christmas spirit. It's all about us. It's all about the lechon. It's all about the Noche Buena. That's not going to go away. Whether you eat your Christmas feast in the restaurant or we send it to your home, that would depends on what happens in the next few weeks, the next few months. But I'm sure people want to feel good and they want to do good and they want to hope. They want to keep their hopes up.
Okay.
What else do you expect from government? I mean, not else, but what do you wish government would do more of in order to avoid lockdowns or alert level 4 quarantine status?
After all these months, and I say this with tremendous gratitude for Secretary Mon Lopez and the Department of Trade and other cabinet secretaries who are hardworking, and you see them texting after midnight, so you know they're still, deliberating about the pandemic. Um, I now understand that we cannot expect government to give us the answer. All I want is for government to have dialogue with us, and we can come up with some answers. We can come up with some solutions. I don't want to put the burden on other people. If I can help, I want to help. And a lot of people in the restaurant industry feel the same way. Even with the health service sector, we don't think that the problem lies with them. If we can help them, we should. By just being careful and responsible with our own activities, we can keep ourselves and our friends out of the hospitals. So I don't blame anyone, and I don't want to burden anyone with the solution. Really, this is the biggest problem that involves all of us.
Okay, Mr. Eric Tang, President of Resto PH. Sir, maraming salamat for joining us tonight. At ingat po.
Yeah, Mr. Tang.
Thank you, sir.
Thank you. Bye-bye.
Thank you, sir. And now, joining us is Ms. Ana Isabel Sanchez Ruiz, the Deputy Head of the European Union Delegation to the Philippines. Good evening and buenas noches. Pinaktis
Good
ko yun.
evening, Miss Ana.
Good evening and thank you for joining us. Welcome to the Chiefs. I'd like to ask you first, well, of course, we're going to discuss the 2021 Virtual European Higher Education Fair. I'm almost tempted to ask you first if there is an age limit for that fair, but no. Let's start off with the most basic. Please tell us about the fair. What's up in store for everybody who's interested in the fair?
Well, I can already say that there is no age limit, and this is the second time today that the journalist asked me that question, so it's an easy one.
Oh, good. But Ed is not allowed.
Well,
I was just kidding.
I could say a lot of things.
I'm just kidding.
But let's go down to business. Yeah, the European Higher Education Fair is a fair virtual for the second time. And the purpose of this fair is to bring European higher education institutions like universities, colleges, institutes closer to the Filipino students and also Filipino higher education institutions to open new perspectives for Filipino students. Maybe they have never thought of the possibility to study abroad or in Europe, but hopefully with this fair they will get all the information they need to make that step.
Miss Anna, is this a new thing just resulted from the pandemic, or was this something that was ongoing even before COVID?
Well, this year is the 11th time that the delegation of the
Oh.
European Union and our member states and universities organize this fair. So it's something that has been down regularly since 2012. There was even in 2007. And of course, with the COVID pandemic last year, we had to change the format and do it virtually. In the past, it was a physical fair with different stands and students or any other person interested to go from one to another. But now they have to do it through their electronic devices.
Right, right.
COVID time.
And what courses do you offer?
Well,
What higher education courses? Yes.
yeah, the fair brings different presentations so that the students, for instance, we will have country presentations. So we have 13 European countries participating in the fair. So students can get to know more about the countries if they are places that would be interesting for them to go to study. We also have webinars on different topics like business, technology, tourism, governance, health, many other topics. And we, of course, also have information on scholarship opportunities, because that's something very important for students when they have to go abroad to be able of having some financial support. And there the participants in the fair can get all the information they need, especially on programs such as Erasmus Mundus, that I think is already relatively well known in the Philippines, and other programs financed by the European Union. And then there will be also possibilities for interaction, like
Malakas
virtual
naman sa
meetings,
on-air.
live chats with the university representatives,
Pero sa
and we have
sa-
also a virtual networking event on the 1st of October.
But the actual education is in person, right? Or is it a combination now of online and in-person education?
In Europe, I think in most of the European Union member states, education currently is face-to-face.
Mm-hmm.
I think I know the situation in the Philippines is different, but I think students who may be interested in going to Europe to study, they will have real lessons in real
I
buildings.
think that's a very important thing to stress
Yes.
for those interested. Don't worry, it won't be
People will go
online
to
learning.
Europe.
You will get to travel if you get in. You will get to travel to Europe to study there face to face.
Yes. So what's the first step for Filipinos who are interested? It's a virtual participation.
Fair.
Fair. It's virtual, and then there will be mechanics, of course, for well, showing your interest first, and then they have to qualify, right?
FEA is just a source of information, so it's open to everyone. Of course, it's more targeted towards undergraduate students who may want to go to the European Union to do graduate or doctorship studies, but it's open to everyone. And registration can be done for free at the webpage ehefphilippines.com. And there, interested people can see the program, and they can pick and choose the webinars or the information sessions or other activities that interest them. They are not obliged to follow the whole fair, because the fair takes place over 2 days.
And there will, so each university or school will have its own set of requirements. Is that right?
Yeah, and,
Okay.
and
Yes.
universities participating in this fair, that at the moment are 140, they will provide the information on their programs and activities and their institutions.
So it's basically bringing together
Alright.
all these universities and learning institutions under one platform, so that people can just go to that one platform and have so many choices.
Yeah, to get the information, especially. At the fair, students cannot apply for programs, but they will get all the information on what they are about, how they could apply, how they can apply to a scholarship, etc., so that they can make their own assessment if this is something interesting for them.
And how many Filipinos have actually, do you have any idea as to what kind of participation you get from Filipino applicants or students even?
Well, the fair itself last year attracted almost 9,000 participants. But
Wow.
what I can give you is the figures of the Filipino students who have benefited from a scholarship of the European Union to study in Europe. So far, we have had more than 600 Filipino students who have got a scholarship, and they have completed their master's degrees or PhDs in Europe. And this year, we had 65 students, Filipino students, who got this grantship. And I must say that they are usually very good. The level and the achievements are very high, and the grades they get are very high. So,
And I wonder what courses they actually applied for. Are they more in the sciences or in the arts or humanities?
yeah, that I cannot give you an
Okay.
answer, unfortunately. But this program is not limited to specific areas of studies.
That's right.
They can go to study any of the matters or for any of the professions that is in offer in European universities.
Are there language competencies required, or is English
Oh
enough
yeah.
for all the applications?
Mostly English, but there are also universities, of course, that provide tuition in other languages,
Okay.
like French in France. And so, but I think nowadays many universities, and especially those participating in this program, have also English tuition or bilingual program.
Ah,
Okay.
but language competency, of course, will be a plus. If you're applying, for example, in
In
French.
English, and
Yes.
yeah, and then it's always good.
Yes.
In fact, also to adjust to life in a European city or town. Yeah.
Okay.
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 Miss Ana Isabel Sanchez Ruiz, Deputy Head of the European Union's delegation to the Philippines. Muchas gracias.
Gracias a la
Thank you.
Thank you.
Thank you.
Thank you very much. At ingat po. That'll be all for this Friday edition of The Chiefs. We hope to discuss here. We'll keep the conversation going. Now, before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Edlin Gao.
I'm Ami Paminton of the Philippine Star.
And I'm Lucy Cruz Valdez of News 5, and we are One News.